All right, folks. I hope you enjoyed a wonderful lunch and had a chance to meet some new folks, create new connections. We're going to move on with our afternoon programming. Let me try my best to advance my slides here. All right. We're going to continue by sharing information about our second organization. And as Christy Jordan reminded me, not an organization, but a campaign. So really excited to have Christy Jordan share with us about the campaign that is Tough as a Mother. And Christy Jordan is the Vice President of Community Impact at Signal. And we thank her for joining us today.
Super glad she got that picture off of there quickly. Hi, everyone. I'm Christy Jordan. I'm with Signal, and I'm here to talk about Tough as a Mother, which some of you have come up to the booth, and I'm very pleased that many of you have heard of the campaign. Yes, it is a campaign, a public awareness campaign, which aims to decrease stigma around maternal substance use disorder and connect pregnant and parenting moms who struggle with addiction or any behavioral health concern with the resources that they deserve. I want to talk a little bit about who's behind Tough as a Mother, because in a couple slides, we're going to really talk about how moms, how women can get connected to services and resources through the campaign. So important backstory with who's behind it. So about 5 years ago, the campaign was created because I work for a company called Signal Behavioral Health Network. We are a new behavioral health administrative services organization. The other BHASO, don't blame me for the acronym, I hate it. It is Rocky Mountain Health Plans. So there's two BHASOs in the state. We work closely with the Behavioral Health Administration, and we contract with the network of providers that do behavioral health services in the state. We saw a need to really take a look at why pregnant women were not being admitted into care when we knew that they very clearly needed it. And we learned by doing a lot of research, a lot of stigma and shame that follows that population. So we wanted to create a campaign that spoke to these women to say, you are not alone. Being a mom is tough, but so are you. And we want to empower you to speak up and out about what's going on with regards to behavioral health so we can get you the resources that you deserve. So that said, the regional entities, I don't want you to dwell too much on that, but it's similar to how the regional structure in the state, like the RAIs, manage Medicaid. The BHASOs manage state funding for what's called the indigent population. So folks without any insurance or maybe underinsured. Okay, so that's the regional structure I'm talking about. And that will be more important in the couple slides that I'm about to share with you. So we promote several ways that we would love women to access services and supports. Our website is our largest call to action. It's sort of our resource hub, toughasamother.org. This is where you can find or point women to video testimonials. There's some resource videos. There's a Find Care map. And that Find Care map has substance use disorder treatment facilities, mental health facilities, recovery living. But we've also partnered with Mile High United Way 211, because in that resource directory is a lot of these ancillary wraparound services, right? Where do I find diapers? What about childcare? What about transportation? So we white labeled 211. And what that means is we embedded 211 into the Tough as a Mother website so that maybe our Find Care map has treatment and recovery support services, but they can go to this other resource directory and it is tailored to this population for services that they may also need along their journey. Of course, there's 988. We don't want to confuse our contact information with 988 because 988 is truly for someone who is in a behavioral health crisis. So 911 for physical health emergencies, 988 for behavioral health emergencies. But if it's a mom who's looking for resources, not in an emergency situation, and just wants to find out what's out there for her with regards to options, we invite them to come to our website. Again, testimonial videos, there's the 211 directory. And we're super proud to partner with Heart Beauty, who has a table out here. If you haven't had a chance to meet them, I highly recommend it. But Heart Beauty is a recovery community organization, and we've partnered with them. They run a free virtual recovery group for moms who is led by moms in recovery. It's free, it's weekly, it's virtual, it's Mondays at 6:30, and you can visit our website to get information. I welcome you to send moms that way. It's a really great low barrier place for moms to start because they're talking to other moms who are in recovery, and it's really helpful. The last piece goes back to this BHASO care navigation and care coordination. Whereas before with our campaign, we would put on our little stickers or posters, go to our website, or 988 is a phone number to call. Now that the BHASOs are in the state of Colorado, we now have a phone number for moms or anyone in the state of Colorado to call. Before I get to that, let me talk about the types of resources. I apologize. So this could be anything from mental health care, substance use support, recovery housing, peer support, or any combination when you call either one of these numbers. What this means, care navigation, it's the front door. Say you have a woman in need of behavioral health services or their loved one looking for resources. They don't know where to start. They've probably called 10, 15 different numbers. Maybe there's wait lists. Maybe they've hit roadblocks or barriers, super frustrated, super overwhelming. We have care navigators that answer the phone Monday through Friday, 8 to 5, and we will be on that phone with them as long as it takes. What's going on? Where do you live? What services do you want? What is it that would be helpful to you in your journey? And we're not going to hand them a list of phone numbers and say, good luck. We walk alongside them. We call with them. We will follow up with them. Check on them, see how things are going. And if they need higher level of support, we have care coordinators in-house, and we can escalate this to a care coordination or a care management type of arrangement. So I wanted to promote all of the different ways that moms can get connected to care. And these lines are open to professionals. If you work with a woman that you feel like needs resources, call us. Let's brainstorm together as professionals, put together some ideas or plans to give moms some support. Please follow us on our social media channels. We're on Facebook, we're on Instagram, we are on LinkedIn. We have a Spanish Facebook channel. We really welcome you to follow us and share information, and come stop by the table, get some really fun swag. We have Tough as a Mother swag, and then our baby onesies say Tough as My Mother, which I think is super cute. We have temporary tattoos. I didn't bring them. I should have, because my kids love to plaster them all over their face. I take that as a compliment because I think they're talking about me. But anyway, stop by and see us. Maybe we want to partner or co-brand on something, or we can be supportive to you in many ways. So thank you for the time. I hope you guys have a great conference, and thanks.